Hi, everybody, and welcome back for week number 8 of Introduction to Sports Medicine. This is Dr. Hardy's coming to you once again for your brief overview of this week. All right, this week we are going to be talking about Chapter 11 in the Prentice textbook. This is understanding the basics of injury rehabilitation. This is the building blocks of everything we're going to be talking about the rest of the semester as we start diving into separate body parts and looking at the common injuries, the way that we can assess those things, and then the treatments for those. First, we need to learn the basics of what injury rehab looks like. So make sure you're reading through the materials for this week. Check out the PowerPoint that's connected right here. And then our discussion this week to go along with the quiz is going to be all about methods for controlling swelling. So let me preface this by saying there is good scientific argument out there about should we control swelling. In some cases, maybe letting the body take its natural reactions and go through the swelling cycle that currently exists is going to be the best way for you to progress to a good resolution in the long run. What I want you to focus on right now is there are certain scenarios where controlling swelling is absolutely going to be the best method to follow. So if you have something where you have a more serious injury, you need to dive a little deeper into it with something like imaging, or you need to be able to do a specific orthopedic examination, and swelling can get in the way of doing those things effectively. So you need to control swelling around those acute injuries so you can continue on, whether that's with an MRI or an X-ray, or even just doing those orthopedic examinations to test it, say it's a ligamentous injury. So there are a couple of different methods that are out there that are essentially the same thing. In your discussion, I want to challenge you to utilize one of those acronyms that exists. So one of the acronyms that we talk about is variations are RICE or PRICE. So if we're talking about RICE, it's rest, ice, compression, elevation. That is going to be that one method of controlling swelling. And if we throw the P on there to make it PRICE, that's just protect. Okay. So that's one of those acronyms that we can use. And the other one is going to be POLICE, P-O-L-I-C-E. Same concept. The details of that are listed out in your textbook as well if you want to look into that one. But essentially, both of the same thing is let's take care of this joint. Let's do these things like icing, compression, elevation in order to get rid of the swelling in an acute phase, which means like those first 72 hours after injury. Trying to reduce that so we can move on to those next stages, either of rehabilitation or of examination. Either way, we're wanting to control that swelling right out. But I did want to address that part that is something that's kind of scientifically arguable. And I would challenge you, if you're interested in this information, look deeper into that because it really is a good, interesting argument. As a matter of fact, in a lot of Scandinavian countries, they just don't do that stage to it where they're doing the compression elevation. That doesn't fit with the sports medicine science that they do there, but they also use ice for the same reaction as you do with heat. That's another story that's getting a little too deep into the woods, so I'm not going to dive into that one for you here right now. Last thing, I do want to mention I had a chance to look through a lot of the examinations and grade those at this point from last week. You guys did a really excellent job with that. I just want to stress one more time when it comes to universal precautions to treating wound care that the first stage you have to do is protect yourself as a caregiver. So that means wash your hands, don gloves, other protective equipment if necessary, depending on the scenario. But number one rule in anything you do in sports medicine is keep yourself from becoming another victim. And if you don't become a victim, you can care for even more people. That's why it is so important to care for yourself first and foremost. That way you can help deliver help to others. All right, that's everything I have for you this week. If you have any questions, please don't hesitate to reach out. I'll get back to you as soon as I can. Otherwise, I'll simply wish you the best and good luck this week. We'll see you again next time.